Hi, I'm Xianghua from Fudan University. I'm going to present a paper called Data Engagement Reconsidered, a study of automatic stress checking technology in use. In today's very fast-paced and busy world, stress has become a growing health concern. And although we commonly talk about stress every day, the notion of stress is very complex. There's no unified definition of stress yet. Usually when we talk about stress, we mean psychological stress, which means our subjective feelings and perception of pressure. But there's also physiological definition of stress, which means our bodily reaction to demands or changes. No matter whether it's psychological or physiological stress, it's all very important for us to be aware and effectively manage our stress on a daily basis. Today in the market, we have more and more wearable products that have automatic stress checking technologies embedded in them. For example, Huawei, Garmin, Samsung, they all have related products that have automatic stress checking features. Most of these products, they check our stress based on analysis of heart rate variability or HRV, which is proved to be a reliable indicator of one's physiological stress level. What is not so clear is how these automatic stress checking technologies actually work for people to manage their stress on a daily basis. To address this issue, we conducted some structured interviews with 17 participants who had adopted some of these products and had some experience with automatic stress checking technologies. From the study, we found that most of them adopted the wearable products not for the purpose of stress checking, but for other reasons, such as not missing phone calls, and they only discovered the stress checking technology later on. And we found only very few of them could meaningfully engage with the stress data, and most of them were very confused and could not make effective use of the stress data. Through the study, we also identified a number of challenges for people to engage with the stress data. The first challenge is the lack of immediate awareness. Previous research shows that in the moment data engagement is very important for reflection. But in our case, due to some technical issues or for reasons of stress, the nature of stress itself, it's not very common for them to engage with the stress data in the moment of stress. For example, Huawei's stress tracking technology could only update half an hour. And it was commonly reported when people felt stressed, they were too busy or too occupied that they would not look at the stress data at all. The second challenge comes with the lack of pre-required knowledge. As noted before, the notion of stress is pretty complex, and we found during the study many times users were confused with the high level of physiological stress data when they did not feel psychologically stressed. And the underlying technical mechanism of stress checking was not so straightforward, so many people had some misunderstanding of how it worked. The third challenge is the lack of communal support. Unlike other self-checking technologies, such as sports-related self-checking, usually there are communities formed around these technologies, and they can share related experience and knowledge for them to interpret the data together. But for stress, there's no corresponding communities there yet, so it was hard for them to learn from each other to interpret the data. So by focusing on such a relatively new self-checking technology and relatively complex notion of stress, we uncovered a number of issues with data engagement with self-checking technologies. First, we found that automatic checking is not just to save the label checking, but also it changes the very nature of how people encounter with the data and engage with the data. For example, we cannot assume users intentional checking anymore, and that also means that many times users encounter with the data is in a more casual manner, not in a deliberate manner. And we cannot assume that they have pre-required knowledge ready to interpret the data. So in future, we believe with more and more health data being automatically collected and tracked, we believe that we should not just consider data engagement as looking at the user interface for analysis, but should consider it as a part of self-checking practices with technologies that's embedded in the web of one's intention checking, domain knowledge, technical properties, other users, and learning resources. With that, I'd like to take questions.